Sanbonan. My name is Mavuson Tabiseng. So today I decided to talk about PCOS. PCOS, which is your polycystic ovary syndrome. A lot of females, myself included, suffer from PCOS, and I just want to give you, some smallanyana education on what actually happens. So what is PCOS? PCOS is actually defined by whereby your ovaries, the outer layer of your ovaries are filled with fluids, making them to be actually bigger. So that what happens. So this alone prevents you from, ovulating normally. So some of the symptoms that you experience with PCOS is the common ones, your irregular menses, your absent menses, or prolonged menses, whereby you have your menses for longer days than normal. You might have facial or body hairs as a female, and you might also have acne and also unexplained weight gain. So when this happens, you need to actually start thinking about, PCOS, and you might actually be having difficulties and falling pregnant. So those are some of the signs that you actually experience with PCOS. So this is caused by increased in the androgen in your blood. So when the androgen level is increased, it actually prevents you from ovulating, especially when you want to fall pregnant. That's what happens. So let us talk about the risk factors. The risk factors of PCOS is your unexplained weight gain. So if you are obese, obesity is one of the causes. Your increased androgen level, like I've just mentioned, and you actually have someone in your family who've actually had PCOS, then those are some of the risk factors. I don't know, it's fine. So let's talk about complications. The complications, the one that you actually the one that is actually common is you bleeding non-stop, causing you to have low HB. 2, it's your infertility. 3 is you having a lot of facial hairs, body hairs. Those are some of the complications. And also, when you fall pregnant, your pregnancies do not last. You have miscarriages or stillbirths, or you give birth earlier than you're supposed to. And also, when you have gestational diabetes, which is you develop diabetes when you are pregnant. So those are the complications of PCOS. Then what happens when you come in for examination? What do we actually do? We do your pelvic examination, whereby we need to actually put a finger on your vagina and examine your uterus, and the other hand will be on your abdomen. We're actually checking for any abnormalities, whereby it might be swollen or have irregular shapes. And the definite investigation we do is actually send you for an ultrasound to check how your ovaries are, and isn't analysis. So we also check your HGT. We check your sugar levels to check if it's actually high or not, so that when we do give treatment, if you do have diabetes, we treat you with diabetes. So coming to the treatment is your oral contraceptives. So oral contraceptives actually help in managing PCOS. Your oral contraceptives, your progesterone only contraceptives. If you are bleeding, you are excessively bleeding, we give you progesterone only contraceptives to actually stop the bleeding. And if you are having difficulty falling pregnant, we give you either Clomid or Femara to actually help you, to assist you with ovulation, because those 2 tablets actually assist you with the ovulation. Then you are able to fall pregnant. If you are overweight, we advise you to actually lose weight. And I think I've actually mentioned everything, but then yeah, that is actually PCOS. For any questions, you can just ask me. Yeah, thank you.